Surgeons removed the lymph nodes from under the arms of breast cancer patients for more than 100 years, believing it would prolong their lives. But a new study published last week calls that into question. So Dr. Brad Picard answers the question, will breast cancer surgery change in western Montana?
With surgery for early breast cancer, we remove the tumor as well as the first lymph node or two that drains that area of the breast, the sentinel node. If there's cancer in that first node, it could be in others. So we have removed the rest of the lymph nodes from under the arm, but that brings risks of arm swelling and infection. This new research questions if we're really helping those women. I asked Dr. Patrick Beatty to explain.
Women that did not have lymph nodes taken out were compared to the women that did have the lymph nodes taken out, and the answer was there was no difference. These were women that had their lumpectomies, they had a check of the lymph nodes, they had radiation to the breast and lymph node area, and then they had hormones or chemotherapy, whatever was appropriate for their disease. So they had all this. The only difference was some had all lymph nodes taken out and some didn't. The result was no difference at all, whether you had all lymph nodes out or not. What it means is that if you can't feel lymph nodes in there before the surgery, you don't have to go looking for them. You don't have to take them out. Now, every patient's different. Studies aren't perfect. They're not completely applicable to every patient. There may be circumstances where, well, maybe they should have them all taken out. But in this case, it didn't seem to make a difference. The mop-up, the chemo and the radiation and the hormones seemed to be able to take care of most of the difference, if not all the difference. But, you know, this is something that every patient needs to talk to the cancer doctors about, is this something that's right for them?
Bottom line, women like the ones in this study getting a lumpectomy and radiation still need a lymph node or two taken to see what treatment they might need. But one or two should be plenty in a lot more women. From Montana's news station, I'm Dr. Brad Picard.
And Dr. Brad emphasizes every breast cancer case is unique, and patients need to ask their breast cancer team if this new research applies to them.
Too late. I had 26 taken out.
26?
Yep, big old chunk gone. But I was okay with it in my case, so it's always good to talk
and
to a
doing
doctor.
great now.
Yeah. All right. Well, the high